What's wrong with my son's testes?
So this mother from Indonesia brought her lovely little boy who was 12 months old to my clinic because her relative had recommended me to have a second opinion for her child's condition. So the mother was told that the boy required an operation for his testes because he was undescended back in Indonesia. So they came to me thinking that the child will need an operation for the undescended testes, and therefore I examined him. And on examination, the child had a retractile testis, not an undescended testis. So the difference between undescended and retractile testis is that undescended testis, you cannot pull it down to the scrotum. But a retractile testis is one that yo-yos up and down because of the hyperactivity of the muscle in these little boys. So up to a point where the testis is heavy, just before puberty, the muscle cannot pull it up. But before that, because the testis is still small in these boys, the muscle being active pulls it up and down. So when it's frightened, when it's cold, the child's testis goes up. So when it's calm, when he's in a nice warm bath, the testis comes out. So that's a retractile testis. A retractile testis is completely normal and doesn't need surgery. So that's why I told the mother. This boy does not need surgery because it's completely normal. So to her relief, she went back to Indonesia without having surgery and saved the boy unnecessary operation. So not all children that come to me will require surgery. They need reassurance that the child is normal and that he will progress and grow up as normal. Parents are anxious about the child's genitalia often because one, it can be small, or one, it could be undescended or retractile testes as in this case. So they are worried about the future of the child. So they tend to be cautious, bring the child to a right person, and they get assessed properly so that in this situation, the child doesn't have an unnecessary surgery.